Johns Hopkins Bloomberg School of Public Health. To start us off, let me introduce Delegate Dr. Dan Morheim, one of our few and cherished physicians in the General Assembly. Represents District 11, is Deputy Majority Leader of the Maryland House of Delegates. He's a physician of internal medicine and emergency medicine and a longtime champion of public health and clean energy.
It's so nice to be with some healthcare practitioners. Is this doctors, nurses? Who's behind me here? PAs? All the above. Great. I also want to probably say a few words. Delegate Kumar Barve, the Majority Leader from Montgomery County. I am the only physician in the Maryland General Assembly, and so I deal with all the healthcare issues. And before going into that, I just want to step back for a second. I think in the long run of human history, we're going to look back at the period of time from 1800 to the year 2100, 300 years will be the oil age, because that's about all it's going to last, maybe. It's going to be a small blip in human history, the oil age, as it goes past, because sooner or later, we're going to run out of all the fossil fuels. Plus, I do have a concern that removing all the oil from the skin of the earth is not unlike if we remove the oil from the glands and the skin oil of our bodies. It's not good in the long run, and it takes carbon that we know has been underground for centuries, millennium, and now rapidly puts it into the environment. So we got to look at that, and since we know it's going to get harder and harder to live on the oil economy, what's the vision? What's the vision that we're going to have? And I think there's several areas. One is conservation, which is why we've worked very hard with your support for green buildings, and also, by the way, green healthcare institutions, because we do tend to pollute a bit sometimes in our work, and so we have to be careful about that. Solar, and here we are, plenty of sunlight right now, free and available, just a fraction of which would power most everything on the planet, and so we have a long way to go with improving solar, and I have a bill in to look at solarizing state schools, because they're broad, flat roofs, they're all over the place, there's usually not other buildings around, and they are not always occupied. I mean, they're empty, so they could be great generators of electricity. And, of course, wind. This is, there are people who raise various concerns about the wind energy approach, but if we have the vision to get off the oil economy, we're going to need all those elements, and wind is one of them. And it's time to move forward. I congratulate you for coming. I thank the governor for putting in the bill and the administration for supporting it, because sooner or later we're going to have to get there, and if we don't, we're doing it at our peril. From the point of view of a practicing physician, and when I'm not in the legislature, I am on the faculty at the School of Public Health at Johns Hopkins, but I actually really do practice medicine. We see it. Respiratory illness, heart illness, all kinds of other things. And I think it's also multifactorial, related to some of the other diseases that are on the rise. I don't think anything in healthcare is so linear that you can say this causes that. But in the right combination of person and exposure and circumstances leads to the pollutants in our environment, lead to autoimmune disease, cancers, and all kinds of other things. And so it's pretty clear that the less pollution there is, the better off we all are. The environment is not just something that's out there. It's our bodies, it's our families, it's our children, and our grandchildren as well. So thank you very much for coming out. Thank you for putting a public health perspective on the environment. That's something that gets overlooked, and I want to congratulate you for tying that together. Sometimes we tend to think the environment's something out there, it's elsewhere, but it actually it is all of us. So I'm happy to be in support, happy to be here with you, and thank you for holding this rally. Thank you.